Happy holidays and good health to our Advancing Health listeners. This is Tom Hetterly with AHA Communications. Advancing Health will return with new episodes every Monday and Wednesday in 2025. In the meantime, enjoy two conversations from our audio highlight reel of some of the best podcasts we've released throughout the year, and we hope you and your family have a safe and wonderful holiday and a happy new year. Our first episode is a segment about an extremely timely subject. ChatGPT, is it practical for healthcare data analytics? Featuring three experts from the American Hospital Association. Host Stephen Hughes, Director of Health IT Policy at the AHA, and guests Brian Klein-Q and John Allison, Associate Directors of Health Analytics Policy at the AHA.
So there's this concept of upskilling, right? And I know this is a concern with CEOs everywhere in health systems now that are thinking about applications and investment in AI. And it's an important piece because a lot of, again, let's go back to 2022. And it's, the AI is coming for our jobs. There's the crisis, right? We've now gone to this idea of it's not taking jobs, it's making individuals better at their jobs, right? It's, like in our case, like in the AHA's case, rather than having to hire two more Brians or a John and two more Brians, right? I'm now able to take Brian and John and upskill them to a point where I'm getting much more productivity out of two individuals by upskilling.
I think with something like ChatGPT, that years of like building up this experience and skill set to be able to tackle a problem has really been ameliorated. And to the extent that if I'm an analyst and I'm working at the AHA, which I am, and there's a big question that we have, something we want to answer on a topic that maybe not all people have talked about yet. And there's some data out there, but it's just huge. We don't understand it. Instead of me thinking, well, that's a waste of my time. I shouldn't be actually trying to answer that question.
Right.
Instead, I'm thinking, okay, with ChatGPT, I feel reasonably confident that I can take something that's currently incredibly difficult to understand, and I don't have a ton of background in, and I can still ask this big question from the data and reasonably expect to get an answer and not take years to do it. That's just hard to underscore how game-changing that is, at least from my perspective. Whereas before, I would have asked a really good question about my data, like what is driving this trend that we're seeing in healthcare and hospital utilization and things like that. And while the data sets might have been available to me, a lot of them aren't, by the way, but the ones that are publicly available, I might have just shied away from asking a question. It's like, well, I don't have the next 10 weeks to devote to this. And nowadays, I would say that's a week at most.
But then the other part, which I think again would resonate with most health systems, is this idea of like they've got a lot of data. That's not the problem. They've captured all kinds of data. It's just in all these different places. You have a lot that's in the EHR. You have a lot that may have predated the EHR, right? That you've been hanging on to for years because for regulatory reasons. But are you actually making use out of it to create, again, better outcomes, other business opportunities? Who knows? And then sometimes, again, there are disparate sources, right? What have if you acquired another health system that has a different EHR, you acquired a practice or partnering with a practice, and they've got, again, it's a different EHR, God forbid, paper. How am I bringing this all in, or what tools am I bringing in? And in most cases, those answers are going to be, I have a very hard time doing that internally, right? I'm going to have to, I'm going to have to either move all of this to some cloud-based service, which cost, security risks associated with it, time, when am I going to get value back out of this, as opposed to, hey, this is my data, and now I can take a very narrow approach to my data and solve problems and get value out of my data with my staff inside a health system, right? Which is going to cut the security risk problem, the cost concerns, do I bring in consultants? Do I, all these other issues? I can actually start solving these problems internally because I have tools like, GPT, right?
Probably something to underscore is if you're looking for an application of AI and you're like, well, I'm not a huge health system. I don't have these resources to spend on these more clinically based AI applications, or maybe even some sort of, chatbot things that maybe are more business oriented, consumer facing potentially. A really an area of a lot of low hanging fruit for the use and practical application of AI tools like ChatGPT is going to be data analysis frankly. And some people might find that boring. Other people might find that exciting. But when you I think that's important to contextualize. It's something that ChatGPT does pretty darn well compared to a lot of the other things that it does. It's going to help you think through data problems comparatively pretty well. And I would say if you're looking for a place to kind of grow your hospital, your health system, wherever it is that the business you're working in, it'd be to be thinking about how to apply these tools to data problems. If your analytics department, your data analysis teams, are the people that are helping with decision support, business intelligence, whatever it is, that's the group out of anyone in an organization that I would think would be leading the charge.
Right.
In a very, I hate to use this word because we're in DC, but in a very grassroots way, right? Like you're not being told to do it. It's very organic. It's
Right.
like, this is making me better at my job.
And yes, it starts in data, but I think that, your insight there, John, is good. And I think it's applicable really to even outside of data analytics, right? The idea that the use case came out organically by need.
Yes.
So and I think if there's a lesson there and there's marching orders to then take out, really any level of management in a health system that may be listening to this all the way up to senior executives and board members, is worry less about trying to shoehorn a solution into the organization. It's go down to the practitioners, right? Go to your people in the front lines, go to your experts and ask them about how they could use it, right? And that's where I think you're going to get the most effective, examples, and the most effective tools are going to emerge from that.
It's true that this is an incredible tool and you can solve so many issues and increases productivity so much in the hands of somebody who is competent and somebody who is
in the hands of someone who is competent.
Correct.
Right. You have to have a baseline competent person to start with that you're upskilling, as opposed to it's what you're not doing with ChatGPT or really with AI in general. And you could extend this metaphor out to the kind of the absurd level of, you're not going to turn somebody who didn't go to medical school into a radiologist because they're using an AI tool to look at diagnostic images, right? You start with a radiologist, add the AI onto that, and they get much more productive and much more effective at, picking up abnormalities in the mammogram. Just like you take someone who's got good, or at least a basis with understanding data languages and good analytical skills, add AI, they're going to be much better at doing decision support.
Exactly.
Next up, de-escalating workplace violence by 75% with WellSpan Health. Learn about the steps this major system took to make the workplace safer in this talk between Jordan Steiger, AHA Senior Program Manager, Clinical Affairs and Workforce, and Kenneth Rogers, Vice President and Chief Medical Officer at WellSpan Health.
So, Dr. Rogers, thank you so much for joining us today. We're really excited to learn more about your work, given that workplace violence is, a problem that a lot of our hospitals and health systems across the country are dealing with.
Yeah, it is a huge issue everywhere. Violence against healthcare professionals has gone up substantially over time, and so it is such a huge issue, especially post COVID, with everybody being frustrated, upset about things, and just on edge.
Absolutely. I know that will resonate with a lot of our listeners. So before we get started learning about your work, I'd love for you to tell us a little bit about WellSpan Health and just your role within your healthcare system.
Sure, WellSpan Health is a health system, about 20,000 employees. We're located in South Central Pennsylvania. We cover 5 counties in that area. Comprehensive integrated delivery system in those 5 hospitals: behavioral health. We have inpatient services. We have emergency room services. We have Phil Haven Hospital, which is a freestanding psychiatric hospital with 137 beds, about 200 beds across the entire system for behavioral health.
That's great. And what is your role within the system
So my role is the chief medical officer for behavioral health.
for behavioral health? And you are a physician, correct?
I'm an adult child and adolescent psychiatrist.
Wonderful. Okay. So I know we're here today to talk about the success that WellSpan has had in de-escalating issues of workplace violence. But before we do that, I would really like to learn just about, your own personal perspective as both a psychiatrist and an administrator, on what led you to being so passionate about this work.
So I spent the first part of my career in corrections, a lot of work in juvenile justice. And so one of the things that you learn in juvenile justice is really de-escalation, trying to keep environments safe, and really just trying to really think about the environment almost constantly. And so as I progressed throughout my career and working on inpatient child units and other kinds of settings, you sit there and you look at situations where you're saying that could have been handled so much better, and a situation escalated that really didn't have to escalate. And one of my positions I had before this was at Parkland Hospital in Dallas. And at Parkland, there was a huge initiative around workplace violence, largely because it's a city based hospital. There's a mixed population. There's really not a majority population. And so there was a lot of work that was being done in the largest emergency room in the United States around how do we think about cultural issues, and in those cultural issues how do we think about workplace violence issues that really arise out of things that people aren't really thinking about because the perspectives are just so different between the two individuals that often are involved in the situation.
I mean, that makes a lot of sense. I think that context, in the care environment is so important, and I think a lot of this can often arise from just misunderstandings and miscommunications between people,
Absolutely, the vast majority of them are simply misunderstandings or lack of communication.
right? Which seems like it should be a simple thing to fix, but we know that that's not always the case, right?
When people are stressed, communication is usually the first thing to go.
Exactly, exactly. So, since you've been at Wellspan, I think this has been since the beginning of 2019, if I'm remembering correctly. You've implemented what you're calling the Behavioral Health Emergency Response Team, but we'll call it BERT for today because that's a little easier to
Yep,
say.
yep,
And you've been able to successfully de escalate workplace violence incidents by 75%. Is that right?
that's correct.
Tell me about that. Tell me how this got started and how you've had such success.
So the BERT team has actually been around for a while, and initially it was a very nursing driven model that really focused on inpatient care and trying to figure out how do we help nurses on inpatient units do a better job. My background is largely from emergency departments. I've spent most of my career working in and out of various emergency departments as a consulting psychiatrist. And so when I arrived, the thing that became increasingly clear was there were issues on the floor, but a lot of our workplace violence issues were actually happening in our emergency departments. It was happening in places outside of kind of your traditional patient in bed kind of situation, whether it was with families, whether it was with staff members getting into disagreements with each other. Those were some of the areas where I felt that it was really a problem. And so, as we kind of looked at and talked through some of this, and we looked at the training we gave a lot of our mental health professionals, we felt like this is something that we could really roll out to the system in general so that folks had a greater capacity to be able to actually engage and de escalate situations.
That sounds great. So it sounds like this is a nursing led initiative, or has that changed at all as it's evolved over time?
Still tends to be largely nursing driven for most of the inpatient work. However, in the emergency departments and some of the other areas, there are lots of other people that tend to be more involved, especially mental health professionals, some of our behavioral health counselors, which are master's level clinicians that are engaged in a lot of that work. And so, trying to really be more specific based on the areas where people are located.
That's great. It's always important, I think, to bring up the workforce, because a lot of hospitals and health systems are struggling with workforce issues right now. So trying to think about who is involved, who it takes to make this successful.
Absolutely.
So you mentioned, the on the floor professionals, those master's level clinicians, those nurses, the people that are really doing this de-escalation. But let's talk about leadership and leadership buy-in. Obviously, you as the CMO for behavioral health know that de-escalation works. You know this is a practice that is evidence-based that shows a lot of success. But how did you get other leaders in your organization on board with this?
It really wasn't me trying to get other leaders in the organization engaged. It was the leaders of the organization saying that, Ken, you need to be engaged because it becomes increasingly clear if you're the CEO of a health system that you've got employees getting hurt. You've got a clear vision that there are folks that their morale is dropping. They are frustrated about coming to work. They don't find the joy at work anymore. And nobody wants to go to work to be attacked by a patient or a family member. And so that I think was the vision that our senior leadership of the organization was seeing. And it was really their vision to say, we need to do what we need to do to figure out how to make our employees feel safe, how to help them enjoy work and help to send a message that this is a safe place to be. And so that was where we kind of started this entire process from. And I think the other driver was looking at our emergency departments, which were increasingly busy. We had a lot more boarders at that particular point in time. And as people are staying in emergency departments for, days on end, looking at four walls, and you already have some degree of agitation in the background, it leads to issues that you just, shouldn't have in hospitals. And so there was kind of this buy-in from kind of everybody in the organization from almost day one that this is definitely something that we should address and do something about.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.